Dr. Amina here, and how is everyone doing on this lovely Thursday afternoon, or whenever it is you're watching this video? Currently, we're exactly 1 week from Thanksgiving, and so it's usually a time of celebration and certainly eating, especially a lot of cakes and pies and sweet things. And I don't mean to cramp your style, but I'm about helping you to be more conscious of what you're eating, particularly when it comes to sweet things with added sugar. And so today I am going to talk about metabolic syndrome and let you, you're going to find out what that has to do with sweet things, right? So, I guess this sounds fancy, metabolic syndrome, maybe to the average person. I realized that it might be less straightforward than I would have imagined once I heard a nurse, maybe last year or something, she was talking about, I guess it came up, something about health came up, and she was mentioning, oh, they say I have this syndrome, they told me I have some kind of syndrome, and she didn't even remember the name, but she said it had to do with her weight and her blood pressure and so on. And then I realized that, you have to be specific when you're talking about different situations, conditions, and so on with people, even if they are medical, if it's a nurse, because you can't just assume people know everything. So I'm going to let you know why you should even care about metabolic syndrome. What is it, right? So essentially, metabolic syndrome is basically it's a group of conditions that increase your risk for, serious illness, let's just say, right? So it's 5 conditions, and if you have at least 3 of these 5 conditions, you have metabolic syndrome. What are these 5 conditions comprising metabolic syndrome? 1, being overweight or obese, especially around the abdomen. So specifically, in fact, it's not even the total weight, but your abdominal circumference, the waist circumference. So for females, if your waist size is more than 35 inches, or for males, if your waist size is more than 40 inches, that's not good, and so you need to sort of watch out for that, right? Second component, having a low level of HDL. HDL is one of the good types of cholesterol, high density lipoprotein. But anyway, just think of it as having good levels of the good cholesterol, right? So ideally for women, if your good cholesterol is less than 50, that is not good. For a man, if your good cholesterol is less than 40, that is not good. So you want to have good levels of this, right? Number 3, having high levels of a bad type of cholesterol, and in this case it's triglycerides. So if your triglyceride level is more than 150, that is not a good thing, all right? Number 4, having high blood pressure. So generally, everybody know, well, not everybody, let me not assume, but generally speaking, normal blood pressure is 120 over 80. But when your blood pressure gets above 130 over 85, then you're starting to have a problem, and that is one of the components of the metabolic syndrome. And then lastly, having high blood sugar levels, specifically if in the state of fasting, like nothing to eat or drink for 8 hours, and your blood sugar reading comes out to be more than 100, that's abnormal, that's high. And even though you might not be outright diabetic, it is not normal and a marker of this a component of this metabolic syndrome. So you might not have a blood sugar problem or a blood pressure problem, but if your triglycerides are too high, your HDL, which is the good cholesterol, is too low, and your waist size, your waist circumference is higher than ideal, then you have metabolic syndrome, and you need to be careful about, the prognosis of your health going forward, right? Metabolic syndrome is actually very common. It affects at least maybe about one third of the population in North America. So quite common. Out of every 100 people, there'll be about 33 who have metabolic syndrome. And why do we even care about metabolic syndrome? Why should you care, right? And that's because having metabolic syndrome, having at least 3 out of these 5 conditions, increase your risk of heart disease. And it doesn't increase your risk just by a little bit, but it increases your risk by 300%, right? So somebody with metabolic syndrome is 300 times more likely to have heart disease than somebody who does not have metabolic syndrome. And heart disease, usually has to do with maybe starting to get blockages in the blood vessels, and which is a precondition to a heart attack, right? But in addition to increasing your risk of heart disease, it also increases your risk of stroke, which you can think of a stroke as a brain attack, because the mechanism is the same as a heart attack, blockage of the blood vessels, right? It increases your risk, believe it or not, for cancer, increases your risk for fatty liver disease. Metabolic syndrome also increases your risk for, and ladies, and I know a lot of ladies are listening to this, increases your risk for polycystic ovarian syndrome or polycystic ovaries. And it also increases your risk for sleep apnea, or obstructive sleep apnea, which is when you have a lot of pressure, because of being a bit overweight, it kind of squeezes onto your neck, and so you're not able to breathe in efficiently and get enough oxygen into your lungs when you're sleeping because of how tight the neck is, right? And if you have an idea about medical issues, or if you've been listening to me for a while, you will realize that the whole root of the problem in metabolic syndrome is related to insulin resistance, which occurs when we bombard our bodies with excessive amounts of sugar, right? Sugar, or it could, it could be sweet, sugar sweet, or it can be carbs, refined carbohydrates, which get converted straight to sugar once you eat them, right? So bombarding our bodies with large amounts of sugar, year after year, stresses the pancreas, because the pancreas has to keep producing lots of insulin to help to store the sugar, which it's stored in the form of fat, triglycerides, right? So you eat lots of sugar, your pancreas produces lots of insulin. Insulin is working on all, the cells of the body to store that excess glucose. But then after a while, the cells just get tired of being bombarded by all this insulin, and so they just get numbed to the insulin signal. They just ignore it. It's just like somebody's harassing you all the time. Like they're just harassing you, and eventually you just block them out. You just don't even notice them anymore. So that's the same thing that happens with the cells of the body. And all the cells of the body, by the way, utilize glucose for energy. And so insulin is impacting all these cells. And eventually it just doesn't work anymore, and so you have all this insulin in your blood trying to bombard these cells, but they're ignoring it, and so the insulin goes up and up. And insulin, of course, is the fat storage hormone. So it promotes being overweight. It converts all that excess glucose, all that excess sugar, to triglycerides, and so that is why you have your levels of triglycerides going up. Your blood sugar goes up because of all the excess sugar and so on. And it's felt that also the insulin promotes the development of these cysts in the ovaries. Insulin resistance is related, or is a cause of the polycystic ovaries. Also, as I've mentioned, I believe I did a video on this, where you have this excess glucose being converted to fat and stored in the liver. And so that's why you have the problem with fatty liver disease. Okay, so metabolic syndrome is not just just a syndrome. It's it's an indicator. It's a combination of these different factors, right? Which include being large around the waist, having a low level of good cholesterol, having a high level of bad cholesterol, specifically triglycerides, having high blood pressure, and also having high blood sugar levels. Okay, and so if you have at least 3 of those 5 conditions, you need to start. You probably should see your own healthcare provider and sort of get a proper evaluation of your current situation, and then start making a plan with the help of your provider about what you're going to do, what changes you're going to make to kind of reverse, because all this is reversible. And so what you're going to do to kind of halt and then start reversing some of these conditions in your body. Okay, Before, you know, it might be a while, and of course the holidays are coming up, so you might not be able to get an appointment with your own provider right now. But what you can do is just start paying attention to your sugar intake. Added sugar accounts for a large majority of the sugar and carbs that people ingest every day. And so if you just start looking at the labels of what you're eating, pay attention especially to the added sugar, and generally speaking, you don't want to have more than 24 grams of added sugar per day, right? And every 4 grams every 4 grams of sugar is 1 teaspoon. So no more than 6 teaspoons of added sugar per day. So that's a good start, a good first goal, good starting point to just, focus on keeping your added sugar to less than 6 teaspoons or 24 grams. Look at your labels and you will be shocked to see what has sugar and to see how much sugar you take in. For me, it was, 50-60 grams per day, maybe 6 years ago. Unfortunately, I'm down to within that 6 teaspoon limit, often less than 6. Okay, so let me know if you have any questions. Start paying attention to your health, because you're not gonna find out till you start paying attention. And if you need to ask me any questions or reach out in any way, please feel free, and I'd be happy to address whatever. Okay, all right, well, have a good evening, and I hope Thanksgiving next week goes well for you. But I'll probably do a video before then. Bye.